I'm Craig Smaler, RN, Senior Housing Nurse for Newbridge Services. And this is the DMHS Medication Education, Non-Prescription Drugs and Alcohol Training. The most common non-prescription drugs that our clients have access to are the over-the-counter herbal supplements, which are being accepted by an increasing number of clients. Herbal products are medicinal agents obtained from plants with limited regulatory oversight and having resourceful direct-to-consumer advertising. Many herbal products have made their way into store shelves and into the client's self-prescribed therapy. Most clients consider herbal remedies at least as safe and as effective as their medications. Most clients do not reveal herbal use because they do not view them as drugs. Natural should not be mistaken as synonymous with safe. Herbs are marketed in the United States as teas, powders, liquids, extracts, tablets, and capsules. In addition, familiar multi-ingredient products like vitamins now have herbal components added. All medicines have potentially unexpected effects, including toxicity, and herbals are no different. The dangerous interactions of over-the-counter herbal supplements and over-the-counter herbal drugs with prescription drugs are only beginning to be realized. The most common side effects, such as nausea, vomiting, and diarrhea, frequently occur with herbs when they're consumed as teas, tablets, or capsules. Garlic. Besides its use as a food or a food additive, garlic supplements should not be taken with prescribed medication, as with anticoagulants, due to their negative interaction. Ginkgo biloba contains active compounds that can cause the side effects of headache, dizziness, restlessness, nausea, vomiting, and diarrhea. Ginseng. Several products are made from the dried root, such as extracts and teas, as well as capsules and tablets. Side effects may include nervousness, excitation, insomnia, inability to concentrate, headaches, and hypertension. Ginseng, when taken with antidepressants, results in a manic condition. And given widespread mislabeling, covert ingredients, which are not listed in the ginseng product, may be responsible for many of the adverse side effects. Kava. The side effects of kava are headache, dizziness, and gastrointestinal discomfort. Localized numbness may occur after oral ingestion, and with long-term use or high dosages, kava may cause dry skin, dry, scaly skin, and yellowing of the skin and their nails. Taking kava with antidepressants, including alcohol, should be avoided due to their negative interactions. Mahung contains ephedrine, which is used to dilate the air passages in the treatment of asthma. It is not considered a safe herbal. It is a dangerous stimulant that can cause insomnia, psychosis, seizures, stroke, myocardial infection, and even death. Saw-palmetto. The most commonly used drug that is used for the treatment of prostate problems is an extract of berries from the saw-palmetto plant. Side effects are headache, nausea, abdominal pain, constipation, and diarrhea. St. John's wort. It is believed to help mild depression symptoms. It has been studied in large clinical trials that compared it with antidepressant medications and placebos. Overall, there was not much difference from taking a sugar pill. It should not be taken with prescribed antidepressant drugs. Valerian root, a sedative that can cause headaches, gastrointestinal problems, excitability, and tremors of the hands and feet. Clients taking alcohol or other sedatives should avoid valerian. The use of alcohol and medications, both prescribed and over-the-counter, are a bad combination. Even very small doses of alcohol should not be taken with antihistamines and other medications with sedative effects. Larger amounts of alcohol cause larger problems. especially when used with Tylenol or acetaminophen that is taken at the same time or even shortly after the drinking of alcohol has stopped. Many medications can interact with alcohol, leading to an increased risk of illness, injury, and death. Alcohol and medication interactions are about 25% of all emergency room admissions. A medication must travel through the stomach and into the bloodstream to where it helps some organ or tissue to get better. Then it is metabolized and eliminated by the liver or kidney. Alcohol behaves similarly, traveling through the stomach and the bloodstream, but also acts upon the brain to cause intoxication, and then it is metabolized and eliminated by the liver. Alcohol can compete with a medication for the same set of enzymes, and thus cause a significant weakening of a medication's effectiveness. This interaction increases the client's risk of experiencing harmful side effects and diminishes the medication's beneficial effects. Thus, a client who drinks alcohol may need higher doses of medication than those required by a non-alcohol drinker to achieve the same beneficial therapeutic level. Also, enzymes activated by chronic alcohol consumption can transform some drugs into toxic chemicals that can then damage the liver or other organs. Antibiotics are used to treat infectious diseases. In combination with alcohol, some antibiotics may cause nausea, vomiting, headache, and a decrease in the effectiveness of the antibiotic. Antidepressants. Alcohol and depression have a serious interaction. Alcohol increases the sedative effect of antidepressants, which impairs the coordination of mental skills required for functioning. Antihistamines. Drugs such as Benadryl are available without prescription to treat allergic symptoms and insomnia. But alcohol intensifies the sedation caused by antihistamines, resulting in excessive dizziness and dangerous sedation. Antipsychotic medications, drugs such as Risperdal, Zyprexa, and Seroquel, are used to diminish psychotic symptoms such as delusion and hallucinations. Alcohol increases the sedative effects of these drugs, resulting in impaired coordination and potentially fatal breathing difficulties. The combination of chronic alcohol ingestion and antipsychotic drugs may result in liver damage. Non-prescription drugs, dietary supplements, or herbal remedies very rarely carry drug and alcohol interaction warnings. Nevertheless, they can be the source of many dangerous interactions and side effects with a client's psychotropic medications. Dietary and herbal medications are marketed directly to the client. They advertise their positive health and nutrient claims without clearly citing their negative side effects or interactions with other drugs that are hazardous to the client. The assumption that more is better can cause liver damage to the client's excessive intake with the fat-soluble vitamins A, D, E, and K. Or the extra Tylenols taken for that massive hangover after a night of drinking alcohol. Remember, many clients believe that their over-the-counter megavitamins, remedies, supplements, or alcoholic beverages are safe and are not actually potentially harmful medications. Clients also want to be in charge of their own health management. However, their lack of awareness and education can lead to potentially harmful medication interactions. Staff should take an active role in providing clinically proven and candid medication education to their clients. Clients need to be encouraged to be more open in their communication of exactly what non-physician prescribed, over-the-counter, megavitamins, remedies, supplements, or alcoholic beverages they are adding to their physician-prescribed inventory of medications. This will allow the staff to educate the client and to help prevent any diminishing of the client's physician-prescribed medications' beneficial properties. The test for non-prescribed drugs and alcohol. Question 1. The most common non-prescription drugs that the clients have access to are the self-prescribed, over-the-counter herbal supplements at the local store. True or false? Question 2. The interactions of over-the-counter herbal supplements or herbal drugs with prescription drugs are beginning to be realized as a real danger to our clients. True or false? Question 3. Only the all-natural herbal supplements are the safe kind of herbal supplements that a client should consume with their medications. True or false? Question 4. The most common side effects of nausea, vomiting, and diarrhea occur when natural herbal supplements are consumed as teas, tablets, or capsules. True or false? Question 5. Garlic supplements can be safely taken with all prescribed medications if it is taken right before giving the client their anticoagulant medication. True or false? Question 6. Ginseng, when taken with a client's antidepressant, can sometimes produce a manic condition in some clients. True or false? Question 7. The use of alcohol medications, both prescribed and over-the-counter, are a bad combination and should be avoided by the client. True or false? Question 8. It is best to take Tylenol or acetaminophen at the same time or shortly after drinking a large amount of alcohol for the protection of a client's liver. True or false? Question 9. Alcohol increases the sedative effect of an antidepressant, antipsychotic, and antihistamine drugs, resulting in the client's impaired coordination. True or false? Question 10. The assumption that a higher dose of a fat-soluble vitamin, such as vitamin A, D, E, or K, can make you healthier, can really cause you to have liver damage. True or false? This concludes the DMHS, Medication Education, Non-Prescription Drugs, and Alcohol Training in Service. Thank you.